Okay, hi. So today we have a challenging case. This nice gentleman had dermalight injections done way back and didn't work out too well. It left a lot of lumps and bumps, and he's had many procedures to try to fix it, and nothing has really worked. As a last resort, he has decided to get these areas excised. And he and I have gone back and forth many times trying to figure out the best possible location of incisions to get the best possible outcome in terms of camouflage. And not an easy case, but um, we still gotta do it. So we did the markings together. We are going to do it again, and I'll show you the markings as well. So let's get started. The pictures are deceptive because they really don't show very well as to what it looks like in certain lights and shades. So if you catch it with the right angle, you'll be able to tell. So now you can see there's a lot of depressions all around this area and a lot of scar tissue as well. So now that I've zoomed in, you can see the different scars, and it literally is irregular surface with dimples, irregularities everywhere. And once we mark it, you will have an idea exactly what the patient is trying to achieve. The patient is very astute in terms of his ability to figure out what exactly he wants, and that really makes my job easier because these things are very tricky and we really need to respect the patient's wishes. Otherwise you can do what you want, it's not going to look good. There we go. Let me make sure, yep, there you go. Now we can see much better zoom now. So I'll have the patient gently smile so you can see how it changes. So right there and right here as well. Great, let's get to work. So we have done the drawings. As you can see, these are different than what we had initially started, but this always happens with all my patients because I take a lot of input from the patients and I have them draw as well with me and try to camouflage the best we can and try to remove as much as we can of the area of concern. So you can see that this is going to be irregular just by the nature of the drawings, and which is good, which is going to hide it much better, and the end result should be a lot better than what we have right now. And let's go on to the other side. Same issue over there where we had to make a little bit of different drawing than what we had decided yesterday. Okay, same on this side. It's changed quite a bit, and this is going to be a difficult closure. And I'm really concerned this is going to lead to a dog ear. I'll have to take out a Burroughs triangle, which might lengthen the incision, but we have no choice because we have to get this big lump out here. This is the area that really made it difficult. The rest is easy, but let's go ahead and let's do it. Let's take a few pictures. Okay, so when you do these markings, these are tricky because you don't know which way it's going to land in terms of the closure. And it's just like a jigsaw puzzle, but not a 100% accurate jigsaw puzzle. There's difference in the length on one side and the other, so you have to compensate by either the halving principle, where you start with one half and then keep halving, or you can have to do Burroughs triangles and stuff, and you gotta know exactly if you have to extend which way you'll go to minimize the appearance or obviousness of the scar. So if you come in here, I'll show you. So before I start, what I did was, I have this. I have a feeling this will close. This is going to be a pain in the neck. I might end up having to take a Burroughs triangle. So I mark the nasolabial groove going all the way into the marionette area. So this way, if I have to extend, I know which way to extend. So I wanted to do this before we get started. Otherwise, if there's a lot of swelling and stuff or local anesthesia, you can't tell which way is the natural groove. So that'll help me in terms of my decision making. Let's get started and see which way it goes. Okay, so we're all done. Let's get a little close up. And as you can see on the right side, we have an irregular snake-shaped S, and came out really well together. It was challenging, but came out pretty good and looks great. Very happy, and it's raised like a speed bump, and that's what we want. Let's go to the other side. Okay, so we are done. As you can see, again, an irregular S-shaped closure, and following the nasolabial fold into the marionette, so that should hide really well. And from the tangent, you can see that it is raised like a speed bump in most of the areas. The most or the tightest closure was right here, and that was very difficult because we took a huge chunk. So down the road we might even have to put a little filler to kind of even it out, but right now it's too premature to think of it. I think right now most important thing is getting it all healed and settled, and then we can play around with either fillers, fat, or something else. Good, very happy, we'll keep you posted. Okay guys, here we are, post-op day number 6, and it's looking fantastic. The swelling has gone down dramatically. There's some bruising but not too much, and as you can see it looks like a little speed bump, and that's exactly what I like to achieve, is a speed bump. Once you have a speed bump, it will settle down, and down the road it's going to look good. So here as well. Okay, there we go. So you can see right there, I'll go on a tangent, and there you go, right there, exactly. So with time, with massage, with laser or microneedling, it will look really good, and that is the plan. And hopefully we'll keep you posted. Our patient is not nearby here, but at least we can do FaceTimes, and he's very good about sending photographs. So I'm very excited. Cannot wait for this to get better and finally have the revealing at 1 year post-op.